of 12 on Health. You're watching News 12 Connecticut, as local news gets. Now, many may find winter weather annoying, but what's worse is the bitter cold and snow and ice can literally be a pain in your neck or lead to back pain. Here to tell us how the weather might be affecting your body and how you can ease that pain is the doctor of chiropractic, Brian Yomtov. Brian, who's also an acupuncturist, comes to us from Advanced Chiropractic and Wellness in Stamford. Thanks for being here. Now, you've got Terry doing a move here. Go ahead and talk us through what he's doing.
Well, we're doing some back extensions, which we're going to try to strengthen the lower back muscles. It's a pretty simple exercise. You can do at home. You can do it at the gym. You see a lot of these balls in the gym. It's pretty easy to do.
Yeah, you do see these at every gym. While he's doing this because he has back pain or to prevent it?
To prevent it.
Okay.
It's to help strengthen his low back, so he wouldn't have to worry about that later on.
And if he's prone to back pain, is it okay if he still does this?
Because it's not such an invasive exercise. It's just little bit of extension, not too much. I have to make sure he's doing it properly, because if he did come back too much, he'd actually hurt himself. So it's very important to make sure he's doing the exercise right. So it's the quality.
When he's doing this, show us where he's getting the workout.
He's getting the low back right here. We call these the erector muscles. Okay, he's watching not too much with his. He's not using too much of his pelvis, just his low back. So extend back a little bit more. Extend back.
And I should point out that Terry does not have back problems. He was kind enough to be our model.
Okay.
Go ahead.
Okay.
And is there an arch involved, or you don't want them arching?
I don't want them arching too much, because the way our spine is set up, we don't want the bones to be rubbing against each other or jamming backwards.
Pushed together.
Yeah.
Okay. Now I know you wanted to point something out with a tennis ball. Go ahead and do that, because this is something people can do at home.
Okay.
Just have a tennis ball kicking around.
It's a simple tennis ball. Terry, I'd like you to touch your toes. Be careful. Don't overstrain yourself. You see how far Terry brings his hands down? He can't really touch his toes. Terry, please come back up. I'd like you to place this ball under your foot, and I'd like you to rub to a little bit of tenderness underneath your foot. This is to show how your foot plays a big role in your low back pain, too, when you do have discomfort. Can you please go to the next foot?
So are you trying to discover something here, or is this simply an exercise?
It's simply an exercise, and we're going to show how it does improve your range of motion and flexibility, too.
Oh, so eventually, if he does this, he will be able to touch his toes?
He's going to do it right now.
And why is that? What muscles is he working on?
He's working on the muscles of his foot, which also play a role up the chain from his hamstrings and his low back.
Wow, people really
Terry,
don't think about that.
Try to touch your toes again. And see how he goes down even further.
So folks might want to do that before they head out in a given day, especially if they're prone to back problems?
And at the end of the day, before they go to bed, so they can, it's sort of stretching them out, but it's not using a lot of equipment and not a lot of time.
Wow. Okay. Now I know you want to back up and tell us what you do for a patient when they head to the office. I know you don't treat them, you don't have them do anything until you've done a thorough exam. What are you looking for in your thorough exam?
Well, first when the patient comes in, they're going to tell me a story. They're going to tell me what they're experiencing, what kind of pain they're having, when it started, how it happened. They're going to tell me all about their medical history. I'm going to ask them what makes it better, what makes it worse, if they're on any medications, what other traumas they've had in the past. And once we've gone through enough of their history that I'm fully comfortable of what's going on, I would have them lay down like this. I would put my hands, because chiropractic means to do by hand. I would put my hand on their body and palpate up their spine and ask them if they're feeling any tenderness. Do you feel any tenderness, Terry?
No.
Okay. And I'd go up the spine and find out where the tenderness is.
You want to know the spot.
The exact spot
on the spine.
And it may not even be tender, but it's also where I would feel it too, because I may also feel the restrictions.
Okay.
Taking a step back from this, before I even would palpate them, I'd also do some testing, different tests to see what causes the pain, because sometimes reproducing the pain would also give me some ideas what's causing the pain too.
That's interesting. They probably don't like you for that much.
No, but it was very minimal too.
Yeah.
So I'd bring the heel to his low back, to his tush.
I know you're trying to look for the word. I got to help you.
And then I bring it to the other side, so you tell me if he feels pain this way, and things like that.
Okay. Now, you discover where his pain is, and then what is the treatment?
Well, the treatment is a spinal manipulation, as we would call an adjustment. Adjustment is taking the spine, which is out of alignment, because that's what happens when you injure yourself, and placing the bone back into place. It sounds sort of barbaric, but it's not. It's very gentle.
And it does sound that way too when you hear the crack.
Yes.
But I understand it provides great relief. Why is that?
Well, the cracking noise is really not cracking. It's gases being released between the joint space. So just like if you were going to crack your fingers,
Right.
you would say.
Oh, you call cracking the knuckles adjusting the knuckles.
I would adjust the knuckles, and you know you can't get the noise won't come back again for another
Right.
15 minutes, so it's just gases being released.
And it is a relief.
Yeah.
Yeah.
So we would do that to his low back or in his mid back or his neck, because just because he may be having problems in his low back, I evaluate the whole person, because the problem may not be coming from his low back, it may be coming from his feet, as we saw that his flexibility and just stretching his feet took the pressure off his hamstrings and his low back.
Now, if somebody comes in, they're in extreme pain, hobbled over, come over here if you could.
Sure.
If they're hobbled over in extreme pain, can you do this on them?
Well, that's the thing. Each person is different. I don't, someone can't just come ask me what would you do for low back pain. It's each person's an individual.
Okay.
Everyone's a different. There's no cookbook approach. There's no flow charts. Everybody's different, so I have to handle, especially the ages of my patients.
Right.
If I have a young patient compared to a senior citizen,
Right.
everybody moves differently. So it would also vary on the patient.
So you're real careful if you're
Yes.
afraid that you're going to inflict any further problems.
And my adjustments are very gentle to begin with. So I may not even adjust on the first visit. The first visit may be just doing my testing, getting an idea. If they do need an x-ray, I would refer them for an x-ray and then waiting to get back the x-ray and the report. I don't x-ray in the office.
So you work with the medical professionals as well?
It's a complementary medicine. I refer out when I need to or work hand in hand.
Thank you so much. Well done. Coming up on 12 on Health, daytime drowsiness but nocturnal at night.